The same point was raised a couple of different times in different ways. And I have felt for some time about the future of our organization really does depend on our ability to deliver on our mandate over the next 5 to 10 years on the strength of our collaborative relationships with other stakeholder groups, other people who have a vested interest in our work, and that we can collaborate with in a way that allows us both to sort of mutually succeed. So I'm talking about clinical leaders here. I'm talking about a more focused set of relationships with a smaller group of pan-Canadian organizations, I think. And I'm also talking about the private sector, which we saw a lot of today, but which we've also explored in the past through different meetings and fora that we've had, and who really will hold insights and keys to solutions we're going to need to take advantage of. So the point that was made a couple of times about the need for collaboration, whether it's clinical leadership or with the private sector, the one that resonated with me is the significance and importance of being strategic and committed to the relationships we choose to develop.
Well, the high-performance sports sector is a sector that's typically always under-resourced financially. So we're always looking for ways that we can move the needle a little bit, move the yardstick some to really reach our objectives given our limited resources. And reaching out to partners like Canadian Tire Bank is a really resourceful kind of approach that we've taken over the last 18 months. And I think it's really quite relevant for the health sector as well, because, typically we're, as individual leaders in sectors, we're always looking for ways that we can do more with less. And certainly in the high-performance sport industry, we need to really challenge ourselves to be bold and reach out to other sectors that we can partner with. So I think it's a really relevant example for any sector. So many times we become so insular and so focused in our own little world, and to really have a chance to go out and be resourceful and reach out to other partners, I think is a great lesson.
If I had to say what resonates with me most, the evening session last night on the podium in Canadian Tire, that just blew me away. And I think the reason it did is because of the relentless focus on what they're going to do and how they're going to do it. So they say this is what their plan is, this is how they're going to move forward, and then they just focus on that and move forward. Set very clear priorities, have very clear criteria, and use data very much to inform the decisions they make. So I thought that was a real-world example of something that we could benefit from in healthcare, quite honestly.
My advice would be look in every other sector to try and partner and challenge our thinking in the healthcare sector in terms of how we as a sector, how we as a nation can make evidence-based decisions, better decisions. With better decisions, we'll have the kind of impact and output that we want with every dollar and hour that's invested by our health professionals.
Well, I think part of the excitement here was seeing so many different highly skilled researchers and decision makers working on common questions or questions that had overlapping boundaries. And I've always been interested in forming relationships and building on my networks, but I'm even more motivated now as a result of seeing the talks here and meeting new people to strengthen those ties further so we can pursue research of joint interest.